Hello, and welcome to today's edition of NHIS in a Week. This is where we bring you a recap of happenings within the authority and the scheme. My name is Lucy Texan Kofi. Now the headlines. Cape Coast Teaching Hospital commends NHIA for timely payments. NHIA launches question of the day to improve public awareness. NHIA CEO pledges to advance universal health coverage. The news in detail. The Chief Executive Officer of the Cape Coast Teaching Hospital, Dr. Eric Njedu, has praised the National Health Insurance Authority for ensuring the timely payment of claims, which he says has greatly improved healthcare delivery.
Speaking at the hospital's annual performance review, Dr. Njedu emphasized NHI's critical role in sustaining healthcare operations and ensuring financial access to medical care.
Mr. Chairman, we'd like to commend the NHIA for the significant improvement in timely payments of claims and we to ask for more improvement. And that is why some of us are very excited to see our big brother, Dr. Victor Bampo, back in Ghana. Sincerely, over the few months and years, the NHIA has discharged itself creditably.
In response, NHI CEO Dr. Victor Asari Bampo reaffirmed the authority's commitment to strengthening partnership and improving efficiency.
You talked about all the things that NHI is doing right, dialysis machines, paying the money on time and so on. What I want to pledge is that we're going to work to make it even better.
The Chief Executive of the National Health Insurance Authority, Dr. Victor Asari Bampo, says he is committed to building on the work of his predecessors to advance Ghana's journey towards universal healthcare coverage.
During his first regional tour in Cape Coast, Dr. Bampo engaged NHI staff and assured them of government's full support. Dr. Bampo also highlighted two key initiatives, Mahama Care and free primary health care, designed to remove financial barriers to medical treatments.
The President has a vision, and the vision is that we attain universal health coverage. He's talking about Mahama Cares, he's talking about free primary health care. Without the work that we do, we will not be able to achieve it.
These policies aim to make healthcare more affordable, particularly for those with chronic illnesses.
The Private Health Facilities Association of Ghana has engaged the National Health Insurance Authority in a high-level meeting to strengthen collaboration and address key concerns affecting private health providers.
During a courtesy call on NHIA CEO Dr. Victor Bampo, PHFAG President Dr. Kwame Boambin Frempong called for a review of NHIA's tariffs to reflect current market prices, as well as faster reimbursement of claims.
Let medicine prices reflect existing market rates. Then we are not helping the situation. It has always been my challenge with NHIA. We talk about it. We decide to come up with a new medicine list, and then it comes up, and then you wonder how they got the prices. I pray that is very cheap, become very realistic. Okanshi is right over there. We can go to Okanshi and survey the market and know the prices. The paracetamol price at Okanshi is taken into consideration. I'm sure the tariff for paracetamol will be realistic.
Dr. Bampo assured the Association of NHIS commitment to more effective stakeholder engagement, policy improvements, and an assurance of enhanced claims reimbursement.
I just want to plead that maybe we look at a mechanism where on both sides you can meet regularly. If we can meet every quarter, this would be good because I found it to be very useful. So I think we can do that.
In a bid to create a seamless and interconnected system, the National Health Insurance Authority is exploring the integration of its various management information systems. Dr. Deji Kwatin highlighted that currently Claims and credentialing systems operate independently, often leading to delays and inefficiencies.
We are looking at advocating for some integration of systems in the NHIA so that we can speak to each other. So that claims is not sitting on its own, credentialing sitting on its own, MRO sitting on its own, so that there can be that linkage, so that if there's a member who has been registered or whose card, the system can be more sensitive to pick up some of these things because the systems are speaking to each other.
The proposed integration will also automate credential verification, alerting healthcare providers about upcoming expirations and reducing administrative bottlenecks in claims processing.
And then if credentialing gives a provider credentialing, we can pick this up and okay, this provider has been credentialed from this period to that period. And then we don't block the person out unnecessarily, even though they have been credentialed. And then if the credentialing ends, again, we can pick it up and block that person from submitting still claims.
In another major development, the National Health Insurance Authority Claims Directorate is set to introduce a claims resource portal to improve communication between the National Health Insurance Authority and healthcare providers.
The portal will allow providers to track the status of their claims, whether submitted, pending, or paid in real time.
We are looking at setting up this resource portal. A resource portal not just for claim staff, but for the providers as well. So that on that portal, the providers can actually go in and check. I think I have submitted my December 2024 claims. Have I submitted or not? The portal will tell you, okay, December is submitted. December is pending, is not submitted. You have submitted January, so that they can see that. Have I been paid or not? Because there are complaints about when they get payment, they don't know which month they have been paid for. So we are hoping that on that portal, they can check that.
The portal will also serve as a reporting platform where providers can highlight challenges, ensuring prompt resolution.
And then on that portal, if they have any challenges, they can let us know they have challenges. We have an email though, but if there's something and they can even talk to each other if they have to, the providers, and learn from each other.
Dr. Dechi Kwatin assured healthcare providers that the NHIA remains committed to addressing their concerns and improving service delivery as part of its vision for universal health coverage.
So to our cherished providers, there's a lot you are doing out there. We know you are doing a lot. Coping, managing, there's a lot of complaints about the tariffs, about payment. But we just want you to understand that we are listening to you. And then we want you to trust that we have your back. We have your interest at heart. We do appreciate all that you are doing. We are saying do not give up, because now going forward, things are going to be different and be better. So we at Claims are working very hard to ensure that you get adjusted for what has to be adjusted and you get paid for the good work you have done. So we hope that will translate into what you also give to our members, so that together, all of us will be able to work together to achieve this universal health coverage agenda. Without you, we cannot be. So again, I'll say Ubuntu. You are because of us. So if you are not there, we are not there. So let's keep the love and let's keep the cooperation. Let's keep the trust. Thank you.
And finally, as part of efforts to keep the public informed, the National Health Insurance Authority is introducing a new segment, Question of the Day, where frequently asked questions about the National Health Insurance Scheme will be answered daily. Stay tuned for updates on National Health Insurance social media platforms as the initiative kicks off today.
As part of our mission to achieve universal health coverage, the NHIA is excited to introduce Question of the Day, a new segment designed to keep you informed and empowered about your health insurance. Stay tuned starting today for daily answers to your most pressing NHIS questions. Question of the Day. Do I have to register my newborn baby before he or she can be treated under NHIS? No. The baby can receive treatment under the mother's NHIS membership for the first 3 months. However, it's essential to register your child with the NHIS by the time they reach 3 months old to ensure continued coverage.
You should give me rough off. I don't understand.
I hope you've been taking your medication.
Ajo abeta. Hey, foul. Na say be pedroni body.
Hello, ma'am.
Hello.
Good afternoon.
Good afternoon.
My name is Adam. From National Health Insurance Scheme, I'm here with my colleague and would like to talk to you about the new NHIS app.
Oh, so you people are here to test my faith in you. Listen, let me tell you. There's no power above or beneath that can compete with the supernatural. There's no better health insurance than being kept by the power. And I'm kept by the power. And my whole family is covered. Oh,
Let's see what they have to say.
No need to worry, Ghana. At the power of ye, with over 500 medicines to take care of you, the new NHIS app has you covered. All you need is a valid Ghana card to register for yourself and for others. My NHIS app gives you access to credentialed health facilities and services across the country. Access to healthcare just got easier.
For more news, do log on to our website www.nhis.gov.gh and our other social handles displayed on the screen. My name is Lucy Texan Kofi. Thanks for watching.